I think it is really important that we listen to this type of research and that we find a way as clinical services to be curious and to assess the latest emerging evidence, whether that meets the gaps within our service provision and the clinical needs that young people are presenting with, and then piloting how we might put that into practice and thinking about how it might change our kind of provision as well. So we need to ensure that we're aware of the emerging evidence base and the established evidence base, because often many of us would have worked in CAMH services for a long, long time and may not even be aware of new recommended evidence or research that we should be aware of and be putting into practice. And also have more confidence and more self-efficacy, that kind of belief that we can actually change things, we can influence change as clinicians and as practitioners. And evidence and research, I think, is a really powerful tool in which we can do that. So we can have those types of conversations with our service managers, with our leaders, with our commissioners locally, with NHS England, to be able to say, why aren't we doing this? The evidence and research suggests this might be a good thing, but we're not doing it and we can't wait 15 years. So we need to think about a way of doing it now. So I actually think we're quite uniquely placed as clinicians and as clinical academics to help bridge that gap a bit more.